Coronavirus Frontlines is a special series where we are sharing the perspective of experts at the forefront of combating the COVID-19 pandemic. You may have heard reports that researchers found RNA material from the coronavirus on the Diamond Princess cruise ship 17 days after the ship was vacated. Or maybe you heard that there was widespread environmental contamination of viral RNA in COVID-19 patient rooms at the University of Nebraska Medical Center. Or perhaps you read an article saying that viral RNA could be detected up to 37 days in patients following the onset of COVID-19 disease. This might put in your head that COVID-19 patients are effectively clouds of contagion for months, shedding the virus for days before they knew they were sick and long after they recovered. Calm down. And rest assured that this is not necessarily the case. That's because the test used to detect the virus in these studies doesn't actually measure whether it's still infectious. Let's break down some of the science. The test in these studies uses a very well-established technique called quantitative reverse-transcription polymerase chain reaction, or qRT-PCR. This test demonstrates whether a person is infected or not by detecting the presence and relative quantity of viral RNA. Basically, is the virus in your system? So what you might think about qRT-PCR tests is that measurements of how much viral RNA is detected corresponds directly to how infectious a person is, but that's not what those tests are looking for. Here's the thing. RNA viruses, like the one that causes COVID-19, make a lot of mistakes when replicating their genomes, and sometimes these mistakes result in viral genomes containing fatal mistakes, or mutations, that render a critical viral gene non-functional, meaning they won't infect people who come into contact